Have you ever wondered what really happens inside your body every time you masturbate? Many men don't realize that their prostate undergoes immediate and long-term changes during and after ejaculation. In fact, some of these changes can be surprisingly beneficial, while others could be concerning if overlooked. Understanding these effects is crucial, especially as you age, because they play a significant role in your prostate health. You might not know it, but each time you ejaculate, your body is responding in ways that can impact your prostate's function, hormone levels, urinary patterns, and even your heart health. In this video, we're going to uncover 6 key changes that happen to your prostate when you masturbate, explaining how blood flow, hormone shifts, and prostate congestion all play a part in your well-being. Some of these insights may completely change the way you think about your body and could even help you prevent serious health complications down the road. You might be surprised to learn that something as simple as regular ejaculation can play a role in reducing the risk of prostate cancer, improving urinary function, and even helping with circulation. But as we go through these changes, we'll also discuss how these effects can vary depending on your age and any pre-existing health conditions you might have. By the end of this video, you'll not only understand what happens each time you ejaculate, but also how these changes impact your prostate over time. Stay tuned until the end, because these insights could be the key to taking better care of your health, preventing discomfort, and maintaining a higher quality of life as you age. Let's dive in. One of the most debated topics surrounding masturbation and prostate health is its potential role in reducing the risk of prostate cancer. While it may seem surprising, research suggests that regular ejaculation might help lower your risk of developing this common cancer later in life. The reasoning behind this is actually quite simple. The prostate is a gland responsible for producing seminal fluid, and over time, it can accumulate toxins, metabolic byproducts, and excess hormones. If these substances are not regularly expelled, they could contribute to cellular damage and inflammation, 2 factors that are strongly linked to the development of prostate cancer. Studies suggest that frequent ejaculation helps flush out these potentially harmful substances, keeping the prostate healthier. For instance, a well-known study conducted by Harvard researchers found that men who ejaculated at least 21 times per month had a significantly lower risk of developing prostate cancer compared to those who ejaculated less frequently. Specifically, the study showed that these men had a 33% lower risk of prostate cancer. While this doesn't mean that every man needs to hit that exact number, it does suggest that a regular pattern of ejaculation can have a protective effect. This is important to understand, especially as you get older. Take James, a 74-year-old man with a family history of prostate cancer. Concerned about his own risk, he started researching ways to improve his prostate health. After consulting his doctor, James learned that maintaining an active sex life, along with proper nutrition and regular checkups, could help reduce his overall risk. He made simple but effective changes, including more frequent ejaculation, a diet rich in cruciferous vegetables, and an exercise routine to support hormone balance. Over time, he noticed improvements in his overall well-being and felt more confident about his health. Now, while regular ejaculation alone is not a guaranteed way to prevent prostate cancer, it should be seen as one of many factors contributing to better prostate health. Maintaining a healthy diet, managing stress, staying physically active, and getting regular prostate screenings are just as important, if not more so, when it comes to reducing your cancer risk. So it's clear that regular ejaculation can play a beneficial role, but it's important to consider it as part of a larger, well-rounded approach to maintaining your prostate health. In addition to the potential cancer-reducing benefits, masturbation can also help alleviate another issue many men face as they age: prostate congestion. This may sound unfamiliar, But prostate congestion is a common problem that occurs when the prostate gland accumulates excess seminal fluid due to a lack of ejaculation. This buildup can cause discomfort, pressure, and even contribute to inflammation in the prostate. In some cases, it may lead to more serious conditions if not managed properly. When you ejaculate, the prostate releases this built-up fluid, reducing internal pressure and helping to maintain the overall health of the gland. For most men, this results in a feeling of relief and relaxation after ejaculation. However, for others, especially those who do not ejaculate frequently, this buildup can lead to temporary congestion. This is particularly true for men with benign prostatic hyperplasia, BPH, or chronic prostatitis, conditions that can cause stagnant fluid in the prostate and contribute to irritation. Let me share you a story of Richard, a 72-year-old retiree who lives alone and has been feeling the effects of aging on his health. Richard hadn't been sexually active for months due to his physical condition and lack of a partner. Over time, he began to notice a dull, aching sensation in his lower abdomen, along with frequent trips to the bathroom during the night. Initially, he thought it was just part of getting older, but his symptoms started affecting his quality of life. After discussing his concerns with his doctor, he learned that his prostate was experiencing mild congestion due to infrequent ejaculation, which led to increased inflammation and pressure on his bladder. To his surprise, his doctor recommended regular ejaculation as a way to relieve this congestion and improve his symptoms. By following this advice, Richard began to experience a significant reduction in discomfort and fewer nighttime trips to the bathroom. This example shows that regular ejaculation can be an easy and natural way to alleviate prostate congestion. While it doesn't mean every man needs to follow a strict routine, the act of ejaculation can provide a simple solution for many men who experience discomfort or frequent urination, especially as they age. However, if you continue to experience discomfort even after ejaculation or find that the relief is only temporary, it may indicate an underlying issue that requires medical attention. It's essential to listen to your body and address any symptoms early. Understanding how your body reacts to these changes can help you make informed decisions about your health, ensuring that you're doing everything you can to maintain a healthy prostate as you age. Moving forward from the relief that regular ejaculation can bring, another important aspect to consider is the impact on hormone regulation, specifically testosterone and dihydrotestosterone, DHT. These hormones play a critical role in prostate health, muscle strength, and overall male vitality. When you engage in sexual activity or masturbation, your body experiences a temporary drop in testosterone levels immediately after ejaculation. For younger men, this drop is usually minor, as their bodies quickly replenish the hormone. However, as men age, testosterone production naturally declines, and the temporary dip caused by ejaculation may have a more noticeable impact on energy levels, motivation, and muscle recovery. For instance, men in their 60s and 70s may feel more fatigued after masturbation than they did when they were younger. The good news is that this decrease in testosterone is typically short-lived, and most men will see their levels return to baseline within 24 hours. The more potent form of testosterone, DHT, is also crucial for prostate health. DHT is involved in the development and maintenance of male characteristics, but excessive amounts of it can contribute to prostate enlargement and even hair loss. Interestingly, some studies suggest that frequent ejaculation may help reduce the buildup of DHT, potentially lowering the risk of developing conditions like benign prostatic hyperplasia, BPH, over time. However, this balance is delicate. Too little DHT can affect libido and vitality, while too much may contribute to prostate problems. Take Frank, a 68-year-old man who had been noticing a gradual decline in his energy levels and motivation. He couldn't figure out why he felt sluggish and lacked the drive he once had. After a visit to his doctor, Frank learned that his frequent late-night masturbation habits might be affecting his testosterone balance. His body, already facing the natural decline in testosterone due to aging, was seeing temporary dips each time he ejaculated. With this newfound information, Frank adjusted his routine. He focused on getting better sleep, incorporating strength training into his daily schedule, and improving his diet with nutrient-rich foods. Over time, Frank regained his energy and felt much more balanced, proving that while hormonal shifts are a natural part of aging, they can be managed with lifestyle adjustments. For most men, these hormonal shifts are not something to worry about, but understanding the role of testosterone and DHT in your body is essential as you age. Being aware of how ejaculation affects your hormone levels can help you make better decisions about your sexual habits and overall health. While masturbation itself isn't harmful, moderation is key, especially when it comes to supporting your long-term prostate health and maintaining a healthy hormone balance. Building on the effects of hormone regulation, it's also important to understand the immediate impact that masturbation has on blood flow, particularly to the prostate. One of the first things that happens when you engage in sexual activity is a surge in blood flow throughout the body, and this is especially true for the prostate. The prostate, which is responsible for producing seminal fluid, receives an influx of oxygen-rich blood during sexual arousal to support its role in ejaculation. For most men, this process happens without any noticeable discomfort. However, for some, particularly those with an enlarged or inflamed prostate, this increase in blood flow can lead to temporary swelling and pressure in the pelvic area, resulting in a feeling of fullness or mild discomfort after ejaculation. This is more common in men who already have conditions like benign prostatic hyperplasia, BPH, or prostatitis, where the prostate is already enlarged or irritated. Now, let me introduce you to George, a 74-year-old man who had been living with mild prostate enlargement for years. Most of the time, he didn't experience much discomfort, but he started noticing a dull ache in his lower abdomen after ejaculation. At first, he ignored it, thinking it was nothing to worry about. But as time went on, the discomfort persisted longer, making it more difficult for him to sleep and causing him some distress. Finally, George decided to consult his doctor. His doctor explained that the increased blood flow during sexual activity was temporarily inflaming his already enlarged prostate. The doctor reassured him that moderate ejaculation was still beneficial, but suggested that he make a few adjustments to his routine, such as staying well hydrated, altering his diet, and practicing pelvic floor relaxation exercises. After following this advice, George noticed a reduction in his discomfort, and he was able to enjoy a better quality of life. This example shows that while increased blood flow to the prostate during sexual activity is a natural and healthy process, it can cause temporary discomfort for some men, particularly if there are pre-existing conditions. It's also a reminder that the prostate, like any other organ, requires careful attention and care. For most men, this temporary swelling is nothing to worry about, but it's important to be mindful of how your body responds and to seek medical advice if discomfort persists or if you experience difficulty urinating. Being aware of how your body reacts to these changes can help you make more informed decisions about your sexual health and overall well-being. Continuing from the impact of blood flow, another area that is affected by sexual activity, including masturbation, is urinary function. For many older men, urinary health becomes an increasing concern, and interestingly, masturbation can play a role in how well the urinary system functions. Since the prostate surrounds the urethra, its condition directly impacts urinary flow, urgency, and frequency. When you ejaculate, the prostate temporarily contracts and then relaxes, which can lead to a short-term increase in urinary urgency or the feeling of incomplete emptying, especially if the prostate is already enlarged. This is particularly relevant for men with benign prostatic hyperplasia, BPH, a condition where the prostate enlarges with age and compresses the urethra, making urination more difficult. Many men with BPH report that after ejaculation, they experience a weaker urine stream or feel the need to urinate multiple times in quick succession. This happens because the muscles controlling the bladder and prostate undergo a brief period of readjustment after sexual activity. Take Robert, a 70-year-old man who had started experiencing more frequent nighttime urination. At first, he thought it was just part of aging, but after discussing his symptoms with his doctor, he learned that his prostate had become slightly enlarged, which was affecting his urinary control. He also noticed that after masturbating, he often felt an increased sense of urgency, but struggled with a weaker stream. With this new understanding, Robert began adjusting his hydration habits, limiting caffeine and alcohol, and tracking when he experienced these symptoms most. Over time, he found that these small changes made a noticeable difference, and his nights became more restful as his urinary function improved. This example demonstrates how changes in the prostate, particularly enlargement, can affect urinary patterns. However, it's important to note that for men without significant prostate enlargement, masturbation can actually help relax the pelvic muscles and improve urinary flow over time. Some urologists even suggest that periodic ejaculation may be beneficial for keeping the prostate more flexible and reducing stagnation, which can contribute to inflammation. The key is to pay attention to your body's signals. If you notice that urination becomes increasingly difficult or uncomfortable after ejaculation, it could be a sign of an underlying issue that requires medical attention. Maintaining a healthy lifestyle that includes proper hydration, regular exercise, and monitoring prostate health can all contribute to better urinary function as you age. Understanding how your body reacts to sexual activity can help you make informed decisions and support your urinary and prostate health in the long run. Building upon the impact on urinary function, it's important to explore another lesser-known benefit of masturbation: its effect on circulation and heart health. Every time you engage in sexual activity, whether alone or with a partner, your heart rate increases, blood vessels expand, and oxygen-rich blood circulates more efficiently throughout your body. This temporary boost in circulation can provide mild cardiovascular benefits similar to light physical activity. For older adults, this increase in blood flow may help reduce stress, lower blood pressure, and even improve overall heart health in the short term. However, for some men, particularly those with pre-existing heart conditions, high blood pressure, or circulatory issues, the effects of sexual activity can be more complex. Take Alan, a 73-year-old man who, despite his active lifestyle, began experiencing occasional dizziness and lightheadedness after sexual activity. Initially, he brushed it off, thinking it was just a normal sign of aging. But one evening, after an especially intense experience, Alan experienced a prolonged episode of dizziness, which prompted him to seek medical advice. His doctor explained that his blood pressure tended to drop slightly after sexual activity, which could explain his symptoms. With this information, Alan made several adjustments to his routine. He focused on better hydration, incorporated heart-healthy foods into his diet, and spaced out more intense activities throughout the week. These changes helped Alan avoid the dizziness he had been experiencing, allowing him to enjoy a healthier, more balanced life without unnecessary concerns. This highlights how sexual activity can affect blood circulation, particularly in older men. While masturbation and sexual activity may offer short-term cardiovascular benefits, such as reducing stress and promoting better circulation, they can also trigger temporary changes in blood pressure that need to be monitored, especially in men with heart-related issues. In fact, studies have shown that sexual activity can have a significant impact on heart health, with some experts suggesting that erectile dysfunction, ED, can often be an early indicator of cardiovascular disease. If you experience dizziness, irregular heartbeats, or chest discomfort after sexual activity, it could signal a deeper issue with circulation or heart function. It's essential to take these symptoms seriously and consult with a healthcare provider to ensure that there are no underlying heart conditions. Just as you would monitor other aspects of your health, it's important to listen to your body's signals when it comes to sexual activity and its effect on circulation. Recognizing and addressing any concerns early on can help you maintain both sexual and cardiovascular health as you age, ensuring you continue to live a fulfilling and active life. As we wrap up this discussion, it's clear that understanding the effects of masturbation on your prostate and overall health is essential as you age. From reducing the risk of prostate cancer to improving blood flow and urinary function, the changes that happen in your body during and after sexual activity can have a significant impact on your well-being. While some of these changes are temporary, others can have long-lasting benefits if you approach them with awareness and care. However, it's equally important to recognize when symptoms may signal underlying issues that require medical attention. Maintaining a balanced lifestyle, staying hydrated, and keeping up with regular checkups can go a long way in ensuring your prostate and heart health remain in good condition. Remember, your body communicates with you in subtle ways, and listening to these signals can help you make better decisions about your health. Whether it's adjusting your routine or seeking professional advice, staying proactive is key to aging gracefully and feeling your best. If you found this information valuable, don't forget to like, share, and comment below. We'd love to hear your thoughts and experiences, and your feedback helps us continue creating content that supports you on your health journey. Make sure to subscribe and turn on the notification bell so you never miss our next video. We look forward to seeing you again soon, and thank you for watching.